Blood-borne pathogens and other potentially infectious materials. Blood-borne pathogens are pathogenic microorganisms that are present in human blood. These and other potentially infectious materials can cause disease. Examples include hepatitis B, hepatitis C, and human immunodeficiency virus. Other potentially infectious materials are any body fluid that is visibly contaminated with blood. How are blood-borne pathogens transmitted? For a blood-borne pathogen to be spread, the bodily fluids of an infected person must enter into the bloodstream of another person. The most common cause of transmission in the workplace is when an infected person's blood enters another person's bloodstream through an open wound. Employers must offer blood-borne pathogen training to employees on their initial assignment and whenever new or modified tasks or procedures could affect a worker's risk of occupational exposure. Those who complete the training must be retrained annually. Universal precautions include vigorously washing hands before and after exposure to blood and other body fluids. Healthcare providers should also always wear gloves, masks, goggles, other personal protective equipment or PPE, and use work practice controls to limit exposure to potential blood-borne pathogens. Someone just suffered a severe cut to their hand. You handled the emergency and they have been taken to the clinic for stitches. There is some blood on the floor where the employee was standing. What do you do now? Whether or not you think a victim's blood or body fluid is infected, you act as if it is. All blood and body fluids are considered hazardous material and should be treated as if infectious. Use a blood-borne pathogens kit to clean up. Wear PPE. Dispose of all contaminated materials. A blood-borne pathogen kit can contain such items as gloves, face masks, hand sanitizer, germicide, plastic gown, eye shields, sharps containers.